it's called the Equity Adjuster Waitlist Tool, and it's being used to prioritise patients for non-urgent surgeries in Auckland. And it takes into account a range of factors, so including clinical needs, so how sick a person is, as well as their socioeconomic status, where they live, whether they're in a rural location or in a city, and also their ethnicity. So it's sort of like a point system, and within this system, people of Pacific Islander and Māori heritage are awarded an additional point based on their ethnic background, and that goes into the overall calculation of where they sit on the surgery waiting list.
So why were Māori and Pacific Island heritage people prioritised in a way?
So the justification for this policy, which has been implemented by the New Zealand Health Authority, Te Watu Ora, is that Māori and Pacific Islander people, research shows that they have less access or poorer access to surgeries in New Zealand and tend to spend longer on a surgery waiting list. And so this is part of a broader approach within the Health Authority to address some of the inequalities that have been identified recently.
Yeah. So given that, why has this sort of system become so controversial?
So there has been quite a bit of backlash to this new tool over recent days, with opponents saying that it is discriminatory because it singles people out based on their race and ethnicity. These comments have appeared in local newspapers and are mostly attributed to anonymous surgeons working in the Auckland area where this tool is being implemented. And we've also seen the National Party health spokesperson, Dr. Shane Retty, come out and criticise the policy, calling for it to be scrapped, saying that race and ethnicity should play no role in determining when a person accesses surgery. On the other hand, medical professionals working with Pacific Islander and Māori patients say that it's a positive step towards addressing some systemic inequalities that result in poorer health outcomes for people in that part of the community. So it's certainly an issue that's raised a lot of debate in New Zealand in recent days.
Yeah. How has the government and health authorities responded?
Well, the Health Authority has reiterated that this, within this tool, the most important factor is still clinical needs, so how sick a person is, and the introduction or inclusion of ethnicity as one of the criteria doesn't override the clinical need that's there. Now, they've said that this policy is part of a broader strategy to address or improve equity within the medical system, and they've also committed to reviewing the tool as it's rolled out.
Mm-hmm. And has there been any response from New Zealanders and the public?
Well, there's been a lot of debate within the public space. There are some people that have backed those comments, that calling this policy discriminatory, but certainly among Pacific Islanders that I've spoken to, they're very much in support of this policy and say that it's been it's long overdue that something is done, and to acknowledge that there is racism in the medical system and do nothing to address it is a greater form of discrimination.
Yeah, interesting. We'll watch how it plays out. Good to talk. Thanks for your time, Marian.
Thanks, Beverley.